Hello everyone and welcome to my YouTube channel. My name is Dr. Aditi Kumar and today I will be talking about cell injury. Well, cell injury is a vast topic and it covers a lot of things, but today basically I will be talking about cellular adaptation. So come on, let's start the session today. What is homeostasis? To understand homeostasis, we should know that every cell of our body is particularly structured to perform a specific function. That is, every cell has a particular function and a particular structure, and normally every normal cell is in homeostasis. However, whenever there are stress, which could be physiological or pathological stress, the cell undergoes some sort of transformation. In the earlier stage, the cell adapts to the stress and undergoes some adaptive changes which are reversible. And if the stress factor persists for a longer period of time, the cell undergo injury. As you can see on this slide, I have shown a flow chart in which you can see that whenever a normal cell is predisposed to any stress factors, the cell undergoes adaptation. These adaptations are of various types. For example, hypertrophy, hyperplasia, atrophy, metaplasia, dysplasia. Whenever the stress stimulus persists for a longer period of time, the cell undergo injury. This injury could be reversible or irreversible. The irreversible cell injury is also known as cell death, and the cell death can be of two types, either necrosis or apoptosis. I will cover the cell injury in detail in the next session. Today I will be talking mainly about cellular adaptations. What is adaptation? Adaptation are reversible structural changes in the cell due to physiological or pathological stress. In this, new altered state is achieved, allowing the cell to survive and function. As you can see here in the diagram, you can appreciate the normal cell and then 5 types of cellular adaptation. If you are looking at the diagram, you can notice atrophy. In atrophy, as you can see, the normal cell size is undergoing a reduction. Atrophy. There is reduction in the size of the cell. Then hyperplasia. In hyperplasia, the cell size remains the normal, but there is an increase in the number of cells. Coming to hypertrophy. In hypertrophy, there is increase in the size of the cell. Metaplasia. In metaplasia, there is transformation of a cell from one particular type to another particular type. And dysplasia is a disorganized growth of or development of cells. So what are the 5 types of cellular adaptations? There are 3 plasias and 2 trophies. The 3 plasias are hyperplasia, metaplasia and dysplasia, and the 2 types of trophies are atrophy and hypertrophy. So coming to the topic, hyperplasia. What is hyperplasia? As I have explained before, hyperplasia is an increase in the number of cells. Why does it happen? It happens because of cell mitosis or cell division. There are basically 2 types of hyperplasia, physiological and pathological. And I will be telling you about the examples of physiological and pathological hyperplasia. Physiological hyperplasia. What is physiological hyperplasia? In any condition which is not a disease condition but a physiological phenomenon. For example, pregnancy. Pregnancy is not a disease but a physiological phenomenon. In pregnancy, the uterus undergoes increase in size. But what is the basis of this increase in the size? There is an underlying cellular hypertrophy and cell hyperplasia. So a pregnant uterus is a very good example of both cellular hyperplasia and cellular hypertrophy. Another example is whenever a female is pregnant, her breast undergoes increase in size. So that is another example of physiological hyperplasia. During pregnancy, during lactation, during puberty, there is an increase in the breast size because of increase in the number of cells. Another example is proliferation of normal endometrium following menstrual cycle. So as you all know, every female has a menstrual cycle of about 28 days. After the menses, there is a phase called proliferative phase in which the endometrial cells proliferate. There is increase in the number of cells, and that is an example of physiological hyperplasia. As you can see here, you can appreciate the difference between the size of a pregnant uterus and a normal uterus. As you can note here, the normal uterus is this, and this is the pregnant uterus. So you can see the difference in the size of pregnant uterus and the normal uterus. Here you can appreciate in the histopathological images that there is an increase in the cellular size as well as increase in the cell number. So as you can see, the size of the cell is also increased. These are the myometrial cells which are increased in size, and the number of the cells is also increased during pregnancy. Here you can appreciate this is the histological diagram of breast during pregnancy. So here also you can appreciate this is normal breast histology and this is the pregnant breast histology. In pregnant breast, you can see there is increase in a number of cells. So this is also a good example of physiological hyperplasia. As I have told you, during the menstrual cycle, after the menses, there is a proliferative phase where there is increase in the number of cells of endometrium. As you can appreciate here you can see there is increase in the number of cells, and this is proliferative phase of endometrium, which is after the menses. So these are three very good examples of physiological hyperplasia. Coming to pathological hyperplasia. Pathological hyperplasia, whenever there is a disease condition, which could be anything, it could be an excessive hormonal condition, or there could be a wound in a patient and the wound is trying to heal itself, then there is a pathological hyperplasia. The first example I will be giving you today is endometrial hyperplasia due to increased estrogens. Whenever there is excess estrogenic activity, there is an increase in the cell number of the endometrial cells, and that is known as endometrial hyperplasia. In this condition, the patient will present with excessive bleeding. Another example of pathological hyperplasia is proliferation of the fibroblast and the endothelial cells during wound healing. Skin warts. Well, the skin warts, as you can appreciate here, on the palmar surface of the patient is having these little skin warts. And how are these skin warts being formed? It is because of proliferation of the keratinocytes. As you can see in the histopathological picture here, you can see a massive increase in the number of the cells. So when there is increase in the number of keratinocytes, it can sometimes cause warts, and that is because of actually human papilloma virus. Another example of pathological hyperplasia is after the resection, partial resection of liver, the liver has a tendency to regenerate itself. Now, how does it regenerate itself? There is increase in the number of the cells, which causes compensatory hyperplasia, and there is regeneration of the liver cells. So, you know, sometimes when there is liver transplant, a part of the liver is resected from the donor and is transferred to the recipient. So how do you think that liver regenerates? Well, there is increased cellular division, proliferation of cells, and that is how there is compensatory hyperplasia. Coming to the mechanism of hyperplasia. As you can see here, this is a cell, and there are growth factors outside the cell, and on the surface of the cell there are growth factor receptors. So, whenever a cell is predisposed to any sort of stress, the cell will undergo hyperplasia, and that is there will be an increase in the number of growth factors and increase in the number of growth factor receptors. So, because of increase in the growth factors and the growth factor receptors, there is increased intracellular signaling, and there is proliferation of the cells. So what is the mechanism of hyperplasia? There is an increase in the number of growth factors, there is an increase in the number of growth factor receptors, and then there is increased intracellular signaling, which will lead to cellular division. Coming to the another adaptation, which is hypertrophy. Now, what do you understand by hypertrophy? We can break this hypertrophy into two parts, hyper and trophy. Hyper means increase and trophy means cellular size. So in hypertrophy, there is increase in the size of the cell. There are two types of hypertrophy, physiological and pathological hypertrophy. Now, what is the mechanism of this hypertrophy? Well, in hypertrophy, there is increase in intracellular proteins as well as cytosol and other cytoplasmic components. To simplify it, the cell organelles are increasing in size because of increase in the number of the cytoplasmic organelles. That will cause increase in the cell size. This hypertrophy can be again of two types, physiological and pathological. I have already told you a very good example of physiological hypertrophy, which is pregnant uterus. In pregnant uterus, there will be both physiological hyperplasia and physiological hypertrophy. And the pathological cause of hypertrophy, I will explain you. This pathological cause of hypertrophy is because of increased workload, hormonal stimulation and growth factor stimulation. For example, hypertrophy of the cardiac muscle. In what conditions can you see the hypertrophy of the cardiac muscle? Very simple example is in conditions of pulmonary hypertension or systemic hypertension. So what happens then? Whenever there is increase in the blood pressure, either in the pulmonary vessels or in the aorta, there is back pressure. This back pressure in the case of systemic hypertension is in left ventricle, and in case of pulmonary hypertension is in right ventricle. And what will happen because of this back pressure? There will be an increase in the ventricular size because of proliferation and increase in the size of myocardial cells. So as you can note here in this histological picture, this is a picture of the normal myocardium and this is a picture of the left ventricular hypertrophy, and you can see the increase in the size of the myocytes, cardiac myocytes in this case. So whenever there is some sort of stress, which in this case is systemic or pulmonary hypertension, there is increase in the ventricular size because of hypertrophy, which is also called as left ventricular hypertrophy or right ventricular hypertrophy, depending upon whatever the cause is. And in this, what histomorphological picture you will see? You will note an increase in the size of cardiac myocytes. Another example of pathological hypertrophy is muscular hypertrophy. You have seen the bulky athletes and the bodybuilders, and also you have seen the manual laborers. They have increased muscle mass. Now, how is this muscle mass increasing? It is because of hypertrophy. Because of increased workload, the skeletal muscles are undergoing hypertrophy, which is actually an increase in the size of skeletal muscles. If you are seeing this histopathological picture, you can note there is increase in the size of these skeletal muscles. So here the skeletal muscle is undergoing hypertrophy. Another example is hypertrophy of smooth muscle in pyloric stenosis. As you can see here in the diagram, there is esophagus, stomach and duodenum. When there is the continuation of stomach to duodenum, there is a pyloric sphincter. This pyloric sphincter is enlarged because of hypertrophy of the smooth muscle of the pyloric region. And what happens? Because of this enlarged pylorus, there is again a distension in the size of the stomach, and patient will present with vomiting. So this hypertrophy of smooth muscle is happening because of pyloric stenosis. The pyloric stenosis is the stress factor here. And how is the cell adapting? It is adapting by hypertrophy of the smooth muscles. So this is another example of pathological hypertrophy. Another type of hypertrophy is compensatory hypertrophy. When a kidney is removed, you know that kidney is a paired organ. If one of the kidney is removed, the other kidney will show compensatory hypertrophy of nephrons. So that is an example of compensatory hypertrophy. Coming to the next type of adaptation, which is atrophy. What do you understand by atrophy? As the name itself is telling you, atrophy means decrease in the size of the cell. Now, this atrophy can also be because of two factors, pathological or physiological factors. So, what are the physiological factors which can lead to atrophy of organs? Because of aging, there is atrophy of certain organs. For example, the size of the thymus in a young child is different, and as the age increases, subsequently the thymus atrophies. So that is an example of atrophy. So because of aging, there is atrophy of lymphoid tissue in lymph nodes, in appendix and thymus. Also, after menopause, there is atrophy of gonads. The aging is also a factor which causes atrophy of brain. These were all types of physiological atrophy. Coming to pathological atrophy, there are different types of pathological atrophy, and as I have shown you here, you can see I have divided it into starvation atrophy, ischemic atrophy, disuse atrophy, neuropathic atrophy, endocrine atrophy, pressure atrophy, and idiopathic atrophy. So what happens in starvation atrophy? As you can see here, in starvation atrophy, well, there is depletion of carbohydrate and fat stores followed by protein catabolism. So in this picture, you can see a very sick looking boy, and you can see there has been, because of starvation, all the muscles and the organs have undergone atrophy. This is an example of starvation atrophy. Ischemic atrophy. To explain ischemic atrophy, you know the meaning of ischemia. Ischemia means there is a lack of blood supply. So to give an example, if the renal artery shows atherosclerosis or atherosclerosis, then the renal or the kidney will show atrophy. Because of lack of supply to the kidney will atrophy. There will be a reduction in the size of kidney. So this was an example of ischemic atrophy. Coming disuse atrophy. Well, when you don't use a muscle, either because you have the fracture and a cast was put and muscle was not mobile, or a person is at bed, he's having bed rest and he can't use his limbs. In those circumstances, there is disuse atrophy. Another type of atrophy is endocrine atrophy. To simplify it, you all know about the hypothalamic pituitary axis. You know that the hypothalamus controls the pituitary, and the pituitary is responsible for secretion of hormones like ACTH, TSH, FSH and LH. So what will happen if there is a problem in the pituitary? If there is no pituitary, or if there is hypopituitarism, what will happen? All these hormonal secretion will reduce, and because of that, what will happen? There will be atrophy of adrenals, atrophy of the gonads and atrophy of thyroid. So that was an example of endocrine atrophy. Another type of atrophy is neuropathic atrophy, which you see in the cases of poliomyelitis. As you can see here, in this picture, one of the lower limb is well developed. However, the other lower limb is underdeveloped. This is because of polio, and this is a typical example of neuropathic atrophy. Other types of atrophy are pressure atrophy. For example, if a tumor is compressing, that is putting pressure on the nerve root, there will be erosion of spine. This is just an example of pressure atrophy. Another example of pressure atrophy is in liver when there is amyloidosis. Because of the deposition of amyloid, it is putting pressure and the hepatocytes will undergo atrophy. And the last example of pathological atrophy is idiopathic atrophy, which you can see in the cases of testicular atrophy. Another type of adaptation is metaplasia. So what do you understand by metaplasia? Metaplasia is actually a reversible change in which one adult cell type is replaced by another adult cell type. What are the causes of metaplasia? There could be changes in the environment, there could be irritation or inflammation, or there could be nutritional causes which could lead to metaplasia. The metaplasia are of two types, epithelial metaplasia and mesenchymal metaplasia. Again, the epithelial metaplasia is of two types. What are those two types? It could be either squamous or it could be columnar. So what is squamous metaplasia? When the columnar type of cell is changing into squamous type of cell, it is known as squamous metaplasia, which you could see in cases of some sort of nutritional deficiency. For example, in vitamin A deficiency, there is squamous metaplasia in the nose, bronchi, urinary tract, lacrimal and salivary glands. And what is columnar metaplasia? When the squamous cells is changing into columnar cell type, then it is known as columnar metaplasia. The example of columnar metaplasia is Barrett's esophagus. Also, in cases of healed chronic gastric ulcer, there is intestinal metaplasia, which is again a type of columnar metaplasia. Now, types of mesenchymal metaplasia. There are two types of mesenchymal metaplasia. What do you know? What are the structures in the mesenchyme? Either it could be osseous or it could be cartilaginous. So, two examples of mesenchymal metaplasia are osseous metaplasia and cartilaginous metaplasia. Another type of cellular adaptation is dysplasia. What does dysplasia mean? There is a disorganized growth of cells. This is actually a atypical cellular adaptation. And why is it atypical? Because whatever other types of cell adaptations I have taught you today, all those adaptations are reversible. However, dysplasia could be irreversible. Dysplasia could lead to cancer. So if I want to define dysplasia, how will I define dysplasia? It is defined as the alteration of cell size, shape and architectural orientation of cellular components of the epithelium. And what are the four most important features of dysplasia? There is pleomorphism, there is nuclear hyperchromasia, there is mitosis, and there is loss of polarity. Now, to understand all these terms, you can see here I have put a diagram for you guys, and you can appreciate the normal cells and the abnormal cells here. As you can see, the normal cells are of similar shape and size. The nuclear chromatin is lighter as compared to the abnormal cells, and all the cells have nucleus which are typically located towards the basement membrane. This is called as polarity. So the basal polarity of the cells are maintained in this picture in the normal squamous cells. But in the abnormal squamous cells, you can see there is variation in the size and shape of the cell, which is also known as pleomorphism. There is increased chromatin content, which is causing increase in the color of the nuclear chromatin, also known as nuclear hyperchromasia. There is loss of polarity. You can see in the abnormal squamous cells, all the cells are haphazardly arranged. The nuclear orientation is not as compared to in the normal cells. So there is loss of polarity. And another feature which I have not shown here, but you should always remember, is presence of increased number of mitosis. So this was an example of squamous dysplasia. And the most common squamous dysplasia you can see in cases of cervical intraepithelial neoplasia in cervix. So as I was talking about cervical intraepithelial neoplasia, which was also called squamous intraepithelial lesion, in this picture you can see there are types of grading of dysplasia. The grades of dysplasia could vary from mild, moderate, severe, and this will be subsequently dealt with here when I will be talking about cervical intraepithelial neoplasia in systemic pathology classes. However, this is just to give you a brief orientation about types of dysplasia. So yes, now coming to the end of the session, today in my session I have talked about cellular adaptations, and I will summarize it again for you. There are 5 types of cellular adaptation: 2 trophies and 3 plasias. The 2 trophies are atrophy and hypertrophy, and the 3 plasias are hyperplasia, metaplasia and dysplasia. What do you understand by trophy? Trophy is depicting the size of the cell. So when there is atrophy, there is decrease in the size of cell, and when there is hypertrophy, there is increase in the size of cell. In hyperplasia, there is increase in the number of cells. Meta means to transform. So in metaplasia, there is transformation of one cell type to another mature cell type, and dysplasia is the disordered cellular development. So there are these 5 types of cellular adaptations. The 4 cellular adaptations which are reversible are hypertrophy, hyperplasia, atrophy and metaplasia. So when the stress factor is removed, the cell can revert back to a normal steady state of homeostasis. However, in cases of dysplasia, which is also an atypical type of adaptation, the cell does not revert back to the normal and it could lead to cancerous condition. Now coming to the mechanism, the hypertrophy. In hypertrophy, there is increase in cell size due to increase in the cell organelles and cellular protein. Atrophy, there is the decrease in the cellular organelles and decrease in cellular protein, which leads to atrophy. In hyperplasia, there is increase in the number of cells, which is because of increase in number of growth factor receptors and activated intracellular signaling, which leads to cellular proliferation. In metaplasia, there is transformation in the stem cell, and the transformed stem cell will produce a different type of cell. Like in cases of squamous metaplasia, the columnar cells will undergo squamous change, and in cases of columnar metaplasia, the squamous cells will go columnar change. Remember this: if there is a squamous metaplasia, then the columnar cell is changing into squamous type, and if there is columnar metaplasia, there is squamous cell which is changing into columnar types. So this was about metaplasia, and dysplasia is the disordered cellular growth. So I hope I have given you now enough examples of all these types of cellular adaptations. The definition is clear to you, the examples are clear to you, the mechanism is clear to you, and it will definitely help you to understand this cellular adaptations nicely. Please do subscribe to my YouTube channel, and I will be bringing more educational stuff. You can also ask me questions and I will answer your queries. Do tell me, did you like the session? Did you understand the session? And if you want to give me any sort of inputs to do better, please do let me know. Thank you very much. This was all from me today. Bye-bye.